Minnesota Society of Respiratory Care recognizes the need to address best practices for discharging patients with complex respiratory care needs. An ad hoc committee was created, including members from hospitals, home care DME, and home nursing agencies. The goal of this committee was to develop a best practice guideline for discharging complex respiratory patients from the hospital to the home. Information was gathered from many healthcare providers within the continuum of care to identify what does currently work, what kind of obstacles we face, and what might be addressed to improve the safety and success of the discharge process. After completing our research, the committee worked together to create a simple model to follow for a successful discharge. We hope that this video is a good introduction, and we look forward to teaching you more about the best practices that we have developed.
Anyone involved in the discharge process across the continuum of care will benefit from this best practice guideline. Using this guideline will help all caregivers understand what timeline is needed for the successful discharge of the complex respiratory patient.
The first step in using the best practice guideline is to identify patient needs. Needs will be identified based on support required when the patient is discharged home. This will include medical needs, such as home nursing and equipment and supplies, as well as social concerns. If a patient falls in more than one designated area, we should default to the higher needs level. For example, if a patient has a tracheostomy without ventilator support, they would be identified as a medium need. But if the patient also has significant barriers to care, we should identify them as a high need.
This guideline is intended for use by all individuals involved in the discharge process. This may include respiratory therapists, discharge planners, nurses, social workers, case managers, and DME providers.
At the MSRC, we believe that using this guideline will benefit your organization by keeping you involved in every aspect of discharge planning for the complex respiratory patient. This level of organization will help all facets of healthcare to assure a safe and worry-free transition for the patients from hospital to home.
The MSRC guideline can be easily accessed by going to the MSRC website at msrcnet.com. From here, you will be able to view and print the guideline. If you have any further questions, please email our ad hoc committee at the email address found on the screen. This email address can also be found on the bottom of the guideline. The MSRC is very excited to bring this to you as a resource guide for easier and smoother discharge planning. Look for more tools to use in the future on the MSRC website.